Even though you've been diagnosed with diabetes, you can still get the glucose control you need to feel better and be healthier. But it all starts with knowing where you really stand in relation to your daily blood glucose levels. Now, GlycoMark offers a single blood test that provides a clinically proven measure of the average maximum blood glucose level over the previous 2 weeks. This offers you and your healthcare team a valuable new tool for safely personalizing your treatment for the best outcomes, while potentially minimizing the risk of dangerously low glucose levels. The A1C test measures your average blood glucose control over the last 3 months, but research shows that nearly 40% of people with moderate to well-controlled A1C still experience persistently high blood glucose. That's because A1C and fasting glucose tests can't tell you the whole story by themselves. In fact, patients can have similar A1C levels but experience extremely different blood glucose spikes throughout the day. Consider Bob and Susan. Both have similar A1Cs, but when you continuously monitor their blood glucose and the time they each spent over the American Diabetes Association's post-meal goal, Susan, who has the lower A1C, actually experiences significantly higher and more frequent spikes, whereas Bob's glucose was high overall but less variable. GlycoMark reveals the difference in a way that A1C and infrequent fingerstick testing can't. Susan's GlycoMark value is 3.0, while Bob's value is 12.4. That's because GlycoMark values decrease whenever blood glucose spikes occur. So having a high GlycoMark value above 10, like Bob, means you have better recent post-meal control. The GlycoMark values reveal that Bob and Susan may need very different approaches to treatment. Bob may need medication to lower his baseline glucose levels, while Susan may need therapy changes to address her post-meal spikes. And GlycoMark helps quickly measure improvements based on recent therapy changes. This makes it easier for you and your care provider to safely achieve better A1Cs while potentially minimizing the risk of hypoglycemia. Now you can get additional insight and control you need for a healthier life with GlycoMark. GlycoMark is a simple, non-fasting blood test available through most major laboratories. Ask your doctor about this powerful new tool. If you're a healthcare provider, contact us with questions or to get a clinical interpretation guide that can help you utilize GlycoMark in clinical practice. Thank you.